I'm Dr. Deuk, and it's July 14, 2023. I'm here with a patient who traveled from Pennsylvania to Deuk Spine Institute, Melbourne, because she had thoracic facet pain from about T6 down to about T10 on both sides. She was suffering with miserable pain. I'll let her tell you about it. But she had the Deuk plasma rhizotomy. It's a new technology we use to treat facet joint pain, and it permanently eliminates the pain. Tell us about your pain before your procedure.
Down the side to the left and to the right of my spine just ached terrible. It would come out a little towards my sides. It would feel like it was catching, burning, aching, and now this morning I have nothing. I have like maybe a little surgery pain, but it's just unbelievable. I know I've reached for a couple of things this morning and been like, oh, hey, where's that pain? But no, it's not there, so.
It's gone.
It's gone.
So before the surgery yesterday, you had the pain all the time, so it was always there, and now it's gone.
Yes. Always there. I could not get free of it. And it moved around. Like one joint was horrible one day, the next day it was another one. It covered a large area. It was extremely painful, and it's gone.
So you had the PRP and other injections in the past, which we didn't do an injection yesterday. We burned the nerves to the joint with the Deuk plasma rhizotomy. But how did the other injections in the past work for you?
Anything I did didn't work at all, or the PRP would give me like 3 to 5 days of this sweet relief, and then right back I would go.
And this is different, you can tell. Obviously.
Oh yeah. I mean, even when I say I had sweet relief, I still had pain. It just wasn't like, oh, I'm gonna sit in the chair today pain. Even in the middle of the night, I'd gotten up, and getting up out of the bed is like a major, you go slow, stand up slow. I realized that I just stood up. I just stood up and walked to the bathroom, and I was like, hey, and that was last night in the middle of the night. So I knew that we had gotten it.
And why did you decide to come to Deuk Spine Institute?
Well, the number one reason is I watch all your videos. But I had gone to a physical therapist who had told me about you, believe it or not, in Pennsylvania. He's like, I think because my problem was thoracic, and he's like, we just don't have good luck with that. He had a friend of a friend who had told him about you, told me your name, and told me to go home and look you up on YouTube, and I did. And I sat there and I just thought, this is it, this is the answer, this is where we're gonna go.
And has it been the answer?
It's absolutely been the answer.
Good. Well, you may recognize her because she's also had disc problems. We fixed those discs before.
Yep.
Now tell us how you could tell the difference between disc pain versus facet pain.
I think the big eye-opener for me was the PRP. I would go and have PRP and I would get that relief. But while I was having that relief, I still had horrible spine pain, and that just didn't make sense to me. And that's when I started thinking, I've got two things going on here, two separate things. And sure enough, so I came and got the discs fixed, and they are fixed. They do not hurt me at all anymore. Then I started the opposite of the PRP. I still had the pain out on my sides.
Yeah, off to the side where the facets are. And then we pressed on them, and we found that they were tender.
Yes, they are very tender,
because they're inflamed.
Yep.
And that's characteristic of facet joint pain. So we knew what needed to be done, bring you back and do the Deuk plasma rhizotomy. Well, congratulations, and thanks for sharing your story with us. Safe travels.
Thank you.